Name's Camille Georgis. I'm with Conversation Orthopaedics. Today I am joined by Dr. John Kelly. He's the director of Shoulder Sports Medicine and Pain Throwing Clinic. He's also the professor of clinical orthopedic surgery at Penn Parliament School of Medicine. He's also the 44th president of the Arthroscopy Association of North America. Dr. John, the floor is yours.
Well, thank you. I'm just happy to be here. And if I can, I'm in the fourth quarter of my career, and if I can impart any wisdom to some young learner out there, I'm all in.
We greatly appreciate you. So let's start with some questions. You've built a distinguished career as Director of Shoulder Sports Medicine at Penn and a leader in arthroscopy shoulder surgery. What first drew you to the shoulder and to sports medicine specifically?
Well, I love sports. I played a lot of sports, both high school and in college. And I was attracted to take care of athletes because I've had many injuries myself. And probably one of the reasons I chose orthopedics was I hurt my knee in college. I had a really good doctor. And I said to myself one day, I want to be that guy. And that was they call, I guess, egosyntonic binding. And then I realized when I was growing up, I had an identical twin brother, and he was right-handed, and I'm kind of amphibious. I use both hands. So I right, left, I throw right. So that lends itself very well to shoulder surgery, which is really, you have to use both hands, particularly when you're doing rotator cuff or instability surgery. So it was sort of a natural evolution, and I can't tell you why I've had this attraction to the shoulder. Maybe because of the ambidextrousness and because of the way I see things. Maybe I'm a big picture person. I was attracted to the idea of, shoulder preservation and how we can do all these good things with the arthroscope. So I've had a wonderful career, and I like to think I've helped a lot of people.
Thank you. And as director of the Penn Throwing Clinic, you care for some of the most demanding athletes in sports. What makes the throwing shoulder so uniquely challenging, and what advances most excites you in caring for these athletes?
Well, I'm a product of my mentors, and I like to give credit to three people: Ty Lee, Steve Thomas, and Ben Kibler, who really taught me the ins and outs of the throwing shoulder. And most throwers don't need surgery. Most throwing injuries can be prevented. And our treatment paradigms for fixing the labral tears have been really, I think, flawed. That's why the results aren't good, because I don't think we're fixing them right. So having the relationship with those three people, we've done some gainful research in showing which labral tears need to be fixed, and more importantly, how to fix them. So I think I have a much better, clear understanding of, who needs an operation. I'm averse to this biceps cutting that we see in young people. I don't think it's a good idea. We have some data, thanks to Ty Lee, showing that that's probably not a good thing long term. But it's really been a great adventure to me, and I'm still love doing the research and looking at the questions. And we just did a paper together, those three researchers and I, on the late follow-through phase of throwing, how putting superior anchors can adversely affect mechanics. Now we're going to ask the same question in late cocking. So hopefully we'll have a finished product so we can devise the proper method of fixation, where to put anchors, how many anchors need, and who really needs an operation.
Thank you. And that's actually kind of perfectly segues into the third question that I have for you, which is you're known for a strong commitment to joint preservation. How do you decide when to preserve versus reconstruct, and how has that philosophy evolved over your career?
It's all about being honest with
Mhm.
yourself, and you look at yourself and say what works, what doesn't. And you have to be on top of literature. So I'm a voracious reader, and there's some mentors like Dr. Stephen Burkhart and Dr. Tiro Mahata have shown me that there's not everybody needs a reverse shoulder placement for a rotator cuff. I've been doing these superior capsule reconstructions for probably over 15 years, and I wouldn't be doing them if they weren't working, right? So that's not to say that someone doesn't need a reverse. That's a wonderful operation, but in my experience, in my opinion, I think it's overused, and I'd much rather exhaust all minimally invasive options before we go into the heavy hitters like that. So it's really just the product of being honest. What's going to work? Now the problem is these operations are hard, so you have a choice. You say either I can send it off to someone who does these a lot, or you can just be a thick-headed Irishman like I am and just learn it. Just learn it and practice, 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 and and spend continual refinement on the technique till you can get it down and help people.
Yeah. And you serve as the 44th president of the Arthroscopy Association of North America. What are your priorities for AANA? And where do you see the greatest opportunities to advance arthroscopic and sports medicine surgery?
Well, yeah, my term just expired in May. Now it's Kevin Bonner, who's our 45th president, who's a wonderful man. But what I did with that, the presidential year, was biggest passion I had was international outreach. We are so blessed in America. We have so many resources. We have so much information. Most of us get two air-conditioned OR rooms, all the products we want. And the technology and the knowledge. So one of the things I really tried to accomplish that year was to disseminate knowledge through electronic media to poorer countries so they can get information that we've learned in America and just to share, just the pearls. We have these foundation courses in the Arthroscopy Journal. Mike Rossi, the editor, has been very generous with sharing those. And we have ambassadors in different underprivileged countries to serve as like a liaison to say, what do you need? What can we do for you? We can send you the journal electronically. We can send you ASMAR. We can send you Orthopaedic pearls. We can invite you to chat rooms. So it's a wonderful privilege. This little expression I think is so important. I think my dad kind of taught me, he's like, to much is given, much is expected, right? So we are so overflowing with bounty and abundance in America. We have an obligation to share that.
Yeah, I totally agree with you. I feel like sharing resources and also sharing knowledge
Yes,
to other countries is extreme. That's how the field kind of gets passed down, right?
absolutely.
So,
And guess what? When I traveled, I did a couple. I'm no missionary by any means, but I've done my share of trips. And when I go to these underprivileged countries, I realize these guys, and gals make use of what they got, and they're very innovative. I've
mm,
learned quite a few things. Like, well, we don't have this, but we use this. Okay, okay. So, it's medicine is a vocation; it's not a profession, and you're there just to help patients. And if you can share something, with another country, then I think you have an obligation to.
yeah,
No, 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 none of this hoarding of information. I know this, so you don't know this. No, 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 no. We're all in this together. It's not a profession, it's a vocation. And your job is to help as many people as possible while you're on this earth.
yeah, beautiful, very well said. And you're well known for championing holistic orthopedics and write the Your Best Life column in CORR on topics like resilience, detachment from negativity, and caring for the brain. Why do you believe well-being and mindset are so essential for both patients and surgeons?
I mean, the literature is right there. It's about between 40 and 50% of orthopedic surgeons are considered to be burnout.
Yeah.
That's a fact. And you can't give what you don't have. So you have to take care of yourself first. The old oxygen mask on the airplane, you got to give yourself oxygen before you give it to your person next to you. You got to take care of yourself. I've been blessed. This is my 36th year in practice, still going strong because I have a wonderful marriage. I have a wonderful family. I have a faith that's never abandoned me. And I've learned the principles of self care. I prioritize sleep and exercise. I just got a little, old man workout, I call it, before this meeting. But I've learned the hard way that you can't give what you don't have. You got to take care of your own house first, and you be more present to your patients, and so you can endure that 36-year or whatever 30-year marathon that most of us sign up for.
Yeah, very beautiful. And to kind of bring back on a topic you discussed about surgeon burnout, surgeon burnout and well-being have become urgent issues in medicine. As someone who speaks and writes on this often, what would you say to trainees and colleagues struggling to find balance and meaning in a demanding field?
I say number one is just to get help. Uh, when my brother died, I saw a therapist. There's nothing wrong with seeing a therapist, just to get your priorities in order, focus on relationships, right? Read about wellness. This is one of my colleagues, Jack Flynn, wrote a wonderful book called Peak Performance for Physicians. I recommend it's required reading for any doctor. My daughter, Anne Marie, wrote a book on the resilient physician. I would recommend reading that as well. But I think number one is just to prioritize and do whatever it takes to keep relationships in your life in order. In order. If you don't have those right, you're going to burn out. And I prioritize my marriage. I prioritize my relationship with my two daughters, and my faith. And those things have kept me kind of going. That's my inner compass. And when I say no to things, it's yes to something bigger. Usually my family.
Wow, very, very well said and beautiful. Now, on to the next question. Your research has explored less discussed factors in shoulder outcomes, from metabolic syndrome to cannabis use and orthobiologics. What underappreciated areas do you think deserve far more attention in sports medicine?
For one, for the shoulder, shoulder is an organ. Look at an organ. So why is a cuff tear? You look at metabolic issues, you look at diabetes, you look at vascular issues. I'm interested in Dr. Abuda's done some great work on the lipid rotator cuff, relationship, high lipids, high cholesterol. Actually, there's work on statins maybe and potentiate healing. The shoulder is an organ. If someone has a stiff shoulder, there's almost always an inflammatory condition present, usually in the form of unrecognized diabetes. Glucose intolerance. We did an article showing that metabolic syndrome, actually correlate with stiffness. So the shoulder is an organ, and if the organ is not respected as such, it's going to fail. So you got to treat it holistic. There's lots of literature on like anti-inflammatories, matrix metalloproteinase inhibitors, and cuff healing. So, an inflammatory condition suggests in the shoulder sort of an organ failure. So it's a nice proxy. How many diabetics or pre-diabetics I've diagnosed who come in with a stiff shoulder, or maybe unrecognized thyroid disease or some sort of immune. So respecting the biology of the shoulder, not just mechanics, but I look at the shoulder biologically. And when I do a cuff repair, I try to prioritize tension minimization versus can I put the most anchors in, the strongest construct, double row, triple row, quadruple row. I'm looking at what's a softer, kinder, gentler way of fixing this cuff that's going to minimize tension and encourage biology of healing.
Yeah, that's very beautifully well said. Speaking broadly, where do you see technology and AI offering the greatest promise in sports medicine and arthroscopy, and where do you remain cautious?
Well, you have to trust your database. You have to trust your vehicle. I think it's an evolutionary scheme. I know this thing's called hallucination, stuff like that, but there's a couple of websites, one in particular, and I can mention this because I have no proprietors, but openevidence.com, I use that a lot. I ask a question and say, what's the literature say about this? But I think that, the key paradigm is that we have to be the master of AI. AI can't master us. And I'll go to my grave thinking that no AI will ever overcome really good judgment. And I get very spiritual cut. I think I'm going to say this, I think it's God, Allah related, but I have intuition. I have a sort of an inner wisdom I tap into a lot. I do pray when I make a decision, and no AI will ever surpass that. So, but I do think that you have to use it as a tool, but don't be so like lazy or it just does everything for you. So, when I give a talk, I'll consult AI, but I compose the talk. If I have a research question, I look at the AI, look at the literature summary, say, okay, yeah, I like that. But you have to master it. It can't be the master of you.
Yeah, that's beautiful, very beautiful. And
I'm
as
going to get a big head. You keep throwing all these compliments at me. It's not that good, but it helps.
no, it's extremely your it's a
My
lot.
my my muchu is going to be big when it enters.
No, a lot of great wisdom. It's I think our the people that are going to be viewing this are going to be very well informed about you and kind of your ideas. Very phenomenal. I mean, I'm very honored to do this speech.
Oh, come on. I'm just happy to help. Again, what you've learned in 36 years is hard earned. And everything I try to share, I've learned the hard way. For a while, I wasn't taking good care of myself. And my marriage was, I wouldn't say imperiled necessarily, but we weren't as close as we are now. And it was like wake up call. And the good news is you can have a vocation in orthopedics and still have a family life. You can still do it, but you got to say no. You got to make decisions.
Yeah,
You got to
I
make that
see.
first things first. You got to put first things first, and
Yeah.
everything else will flow from that.
Oh,
Uh, but the other thing that readers should know is you can't have it all. You think you have it all? No, I had to make some sacrifices, and my daughters knew that I took trauma call for 21 years. I did not make every dance recital. I did not make every play, but my wife's a nurse would say, "But Daddy's helping somebody now." So you can do some, you can reframe it, you can position it to your children that dad or mom, whoever's on call, is helping someone now. And I have two well-adjusted daughters. Thank God for that.
yeah, very great, very great. And no, it's like also your talk about like spirituality and kind of the mix in medicine is honestly very inspiring. I really loved that you like the especially when we were talking about AI, you were talking about like how it's kind of like you believe that when you make a decision, you pray about it, and I feel like that's just so beautiful. I
But
really
it's
really
true. And no AI will ever supplant intuition, right? And I call that when people have a problem, I say, why don't you consult someone smarter? Pray about it,
yeah
okay? And we all know what's right and what's wrong. And, you have that inner wisdom. Don't let other things, this is a great quote in the Bible. I'm Catholic and I respect all faiths. I think you have to have a principle center, right? And one of the lines I love is you can't serve two masters.
yeah
It's either do right or do what's best for your OR schedule or pocketbook, whatever you want to. And we're all imperfect. We all give in a temptation, but that's my eye on the prize. I did right today? Did I honor my commitment to do what's you know right and just in this patient's eyes, and not try to honor the OR schedule or my bank account or whether I'm behind on my car payments. And if patients realize that you're in their corner, you'll never have a bad day in clinic. But the thing I really wanted to let the audience know is that the antidote to burnout, number one, is meaning. When you can find meaning in everything you do, that's where the spirituality comes in. You say, who's God sending me today? Who can I help? And you feel that everything that happens to you was ordained from a higher power. Okay, all right, even the complications. I had complications, no one's perfect. There's always a lesson. There's always a lesson. There's always a gift. So when you look at life, it's all good. It really is. You never have a really bad day.
beautiful, very beautiful. Thank you. Yeah, I do like the way you look at kind of I love that you quoted the Bible as well, like the one person cannot serve two masters. I mean, 100%. I really agree with you. It's either
Yeah,
you serve
and
God.
that's in all the major faiths too. That's just
Yeah.
not Christianity. That's all the major faiths say.
Mhm.
You please God first and foremost. That's the basis of Islam. It's just, you're servant of God, right? So you can't serve two masters. You just can't. Yeah,
Yeah.
remember Bob Dylan, the singer, says, a song says, "You gotta serve somebody." Look up the
Well said.
lyrics. You gotta serve somebody.
Yeah. As director of the Sports Medicine Fellowship, you've mentored many surgeons. What qualities do you try to instill in the fellows and residents you train?
Jim Carrey's the director. I'm just the co-director, but I
Mhm.
try to let him. Well, number one, 90% of education is encouragement, uh, and I'd say 95% of surgery is confidence. So I try to instill them some confidence and competency that they can do this, and give them feedback, not harsh critiques, just feedback. So if you can instill them the ability to go in the OR and feel confident that they can handle this, then I've done my job. Now you can't be a false sense of confidence, but you have to teach them the steps and give them feedback and don't castigate them so that they feel like, worthless piece of, cow dung. You say, no, yeah, I wouldn't do that. I wouldn't do that. And I also instill with them just the values that I learned for a long career. Did you call your wife today? Did you get home in time yesterday? Did you spend time with your kid? Did you work out this week? I don't want you staying up all night reviewing this paper. I want you to come to tomorrow work, bright-eyed, bushy-tailed, and do a cursory review of things. Be prepared. You can be responsible, but not being, going to overkill. And the demon of perfectionism is raged within medicine. I learned the hard way. You can't be perfect. Just strive for excellence. Do an excellent job at what you do, but you're never going to be perfect. And the sooner you learn that, the more peaceful you'll be, and the more you'll have to give to other patients.
Yeah.
So, the bottom line is teach them confidence, obviously technical skills, also judgment or decision making. The biggest thing you learn from fellowship is who needs an operation, because you're going to learn, you're going to craft those skills through your own learning center, through your own repetitions. I show some tricks of the trade, but honestly, I learned my craft on my own because the fellowship year is just not enough.
Mhm.
It's not
Yeah.
enough.
Yeah. And
Well
finally,
said.
what advice would you offer medical students and trainees who hope to build a meaningful and fulfilling career in orthopedic sports medicine?
I just think that you just focus on the vocation. Remember that if it's a calling or not, if it's a calling, you never have a bad day. You honor the calling. You look for meaning. Say, who's God sending me this day? And do research to advance the field, not just for have your own name and lights. The more you can get centered into the higher purpose, helping patients, doing research to advance the cause, getting in, benevolent pursuits like mentoring, speaking at conferences, not so much to have your name in lights, but just to advance the ball in learning and knowledge. and prioritize relationships, then you'll get it figured out. If you feel like you're torn between the egoic part, well, I want to do this and that, and I want to be president of that. Some of these leadership things I've been blessed to have, I never really asked for. And if you show competency in a certain arena, and you can show leadership skills, people will ask you to lead. They will ask you. You don't have to like lobby. For arthroscopy, I let it be known that I love to lead because I had this one reason I had this passion to move the ball for the international outreach. And I knew that if I wasn't president, it wasn't going to happen. So it's okay to let people know, yeah, I like that, but to have your name in lights, the power, the prestige, that's never ever going to lead to fulfillment. I'm happy to say through people that I've surrounded myself with that were more talented than me, and I'm thinking of people like Mark Hutchison and our CEO, Laura Downs, our international outreach at AANA has never been stronger, and we've really helped a lot of people in the past year.
Well, Dr. John, thank you for coming on to speak with me in Conversation in Orthopedics. I really appreciate you.
Well, you're a good guy. I can see that you're a leader and you're trying to do this for a higher calling, and I'm happy to help. So I will leave with something my Lebanese grandmother would tell me. She called me khlewi, which is sweet one in Arabic. She say khlewi, Allah fatadini buwijek. That means God's going to open the world to your face. And if you live your life the right way and make priorities your faith and your family, Allah will fatadini buwijek.
Thank you, Dr. John.